Hi, this is Dr. James Zins, Chief of Plastic Surgery at the Cleveland Clinic. You are listening to Interview with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. James Zins, Chair of Plastic and Reconstructive Surgery at Cleveland Clinic. Dr. Zins specializes in facial cosmetic surgery, including facelifts and rhinoplasty. A frequent lecturer at national and international meetings, Dr. Zins has served as the president of the Northeast Ohio Society of Plastic and Reconstructive Surgeons and the Ohio Valley Society of Plastic Surgeons. He is also a founding member of the American Society of Craniofacial Surgeons, a fellow of the American College of Surgeons, and a board member of the American Association of Plastic Surgeons. Additionally, Dr. Zins is a professor of surgery at the Cleveland Clinic Lerner College of Medicine and serves as an oral board senior examiner for the American Board of Plastic Surgery. He also serves on the editorial boards of multiple plastic surgery journals and has published more than 150 papers in peer-reviewed plastic surgery journals and more than 10 book chapters.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. James Zins, Chair of Plastic and Reconstructive Surgery at Cleveland Clinic. Doc, how are we doing today?
So far, so good, Matthew.
Well, thank you for being with us. So let's get this started. What were your goals and aspirations during your residency, and how those changed throughout your fellowship?
Well, that's a great question. Residency. When I went through residency, it was an ordeal. It was a long haul. In those days, you could not get into plastic surgery without first becoming board eligible in general surgery or in one of the surgical subspecialties. So that meant a minimum of 5 years. And a matter of fact, in my case, it was 6 years because I did a year of research as well. So it was 6 years in general surgery. And then it was 2 years in plastic surgery residency and then another year in plastic surgery fellowship. So my background really was 9 years of resident training, of which I must say I enjoyed it thoroughly. It was a great time. And I think it really helped me develop as far as an individual, and it helped me develop as a team player. I always liked sports. I played team sports. My dad tried to get me out of playing team sports. He said, you're not going to be able to play baseball your whole life. You're going to be, but you play tennis, you play golf, you'll be playing that until you're 80. And of course, I didn't listen to him. And I'm suffering from that now. But, really to get to your question, what were my aspirations? In those days, we were actually, I think, somewhat innocent. And I wanted to be the best plastic surgeon that I possibly could. And even from a very early age, I always liked to know a lot about a little. For that reason, I thought it was very important to focus as early as possible in the area of my special interest. And at that time, my special interest was craniofacial surgery. And the reason I got interested in craniofacial surgery was I worked with Project Hope, which, actually at that time actually had a ship called the SS Hope. And I was on the SS Hope in Maceió, Brazil for 3 months as a fourth year medical student. And then after I matched in my surgical residency at the University of Pennsylvania, my first rotation was on plastic surgery. So I had become exposed to plastic surgery on the ship Hope, where we did a bunch of cleft lip and palate surgeries. It was absolutely fascinating. Became very interested in pediatric plastic surgery. And then my first rotation, lo and behold, as a surgical resident, which was an intern at the time, was in plastic surgery. And I met my mentor, who became my mentor really for a lifetime, which was Linton Whitaker. And I became interested in plastic surgery in particular and craniofacial surgery specifically. Again, trying to learn a lot about a little. So I did a year of embedded fellowship, actually combined clinical and research fellowship in craniofacial surgery during general surgery. In those days at Penn, we did our fellowship year actually within our research year within the general surgery rotation. So I became interested in craniofacial, and a great offshoot of craniofacial is facial cosmetic. So I developed a great foundation for facial cosmetic surgery, which I always enjoyed even as a resident. It was an operation, interesting, that most the facelift operation, which I became particularly interested in, was an operation that most of the residents ran away from because they knew that they were going to, what we called hold hooks. And that is, we were only going to assist and we really weren't going to do any significant portion of the surgery. But I always enjoyed the operation. I enjoyed the patient clientele. I enjoyed older women. They knew what they wanted. They were sophisticated. They were not flighty. And it was a great patient population, I thought, that I connected with. So I became interested in both craniofacial surgery initially, and then facial aesthetic as an offshoot of craniofacial, which gave me a wonderful background in facial aesthetic. And then I took my first job. My first job is the same job I have now, although I've climbed the ladder a bit within the department. My first job was at the Cleveland Clinic as a staff surgeon. And early on, it became very obvious to me that the pediatric craniofacial population was a very small population, whereas the potential patient base for facial aesthetic surgery was a minimum of half of the entire United States. So it became very obvious to me that this was a real opportunity to do what I like to do, but also have the opportunity to treat a lot of patients and become an expert in a relatively small field. In those days, again, most plastic surgeons were doing the gamut of plastic surgery and not really focusing tremendously. That's changed a little bit now, but so I focused very early. I tried to learn a lot about a little, and to this day, I basically just do facial aesthetic surgery, which has just been a wonderful career from a technical standpoint. As far as the operations are concerned, they're technically challenging. The anatomy is three-dimensional. We really have to understand that third dimension. It's not a topographic anatomy. It's complex, and it's a small area and a complex anatomy. So that, from a technical standpoint, is challenging. And also the patients are, by and large, just a wonderful patient base. So it's something I've loved. The other thing that I was always interested in, I always liked to write. Even as a high school student and as a college student, I really enjoyed writing. And unfortunately, doctors in general are poor writers, and plastic surgeons in particular are especially poor writers. So that's been something I've been able to do for some time now, and I enjoy doing that. And I especially enjoy working with the residents and fellows, working on clinical projects with them and teaching them how to do clinical research, and probably as important, how to write about clinical research. And that's been very rewarding. So, that's how I got started. I think my plea is focus as early as possible on the areas that you like. The comments are always the same when I make this statement, but I've got to go out, Dr. Zins, and I got to make a living. Yeah, you can go out and you can do everything, but make it clear to your patient base that what you really have a passion for is X, Y, Z. So I hope that answers your question.
Absolutely. And now, taking us through that first job that you took at Cleveland Clinic, what was your mentality heading into that? And what was that process like for in the beginning years of your career?
Well, that was a lot of fun, and not to delve too much into the weeds, but I took my first job. I looked throughout the country, looked very, very carefully at a whole wide diversity of options, both private practice, and there were some very attractive private practices then. In those days, things were wide open, and the opportunities were vast. I think the opportunities are not quite as vast as they were in those days, but the opportunities were vast, and I had an option of lots and lots and lots of different jobs in lots and lots of different places. So it came down to two. It came down to the Cleveland Clinic, and it came down actually to a private practice in Gainesville, Florida. After looking very thoroughly throughout the country. So I took the first job, and I had interviewed at the Cleveland Clinic, and looked, was ingenuous enough to figure they'd just wait around for me forever. Well, 6 months later, I came back because I was going to take the job. Well, interestingly enough, I was only lucky because they had already offered the job to another individual. Had he taken it, I wouldn't be where I'm sitting today. But he didn't take it. And I took the position. And I came in and I walked into the office, and the chairman of the department, Mel Dinner, puts out his hand and says, "You're in and I'm out." And he was going into private practice the next month. So I came into a department where we were just two young plastic surgeons, and then an older plastic surgeon who really wasn't very interested in plastic surgery. And we were sort of on our own to develop. So there was no mentorship here in those early days. And again, if I were going to give advice to a young plastic surgeon, even outside, within your residency, mentorship is easy. You've got lots of mentors around that you can bounce ideas off with and get advice. But after you leave your residency, you still need a coach. Everybody needs a coach, right? You know, Serena Williams did not teach herself how to play tennis by seeing one, teaching one, and doing one. You know, that's not how she did it. She had a coach since she was 5 years old. And that's true, I think, if you look at any of the professional athletes. You know, they started very, very young, and they had a professional coach coaching with them. Through a Tiger Woods, how many coaches that has Tiger Woods have in his career? You know, I think his dad was his early coach when he was 5 or 6 years old, but he's had multiple coaches through. That's how you learn. You learn by taking lessons. And that's why I think it's so important you have a coach throughout your career. So I would say that's extremely important. So I had no coach. We made a lot of mistakes. We acted very immaturely in those days. I was actually, Dr. Randy Yetman and I were the two plastic surgeons who were the busiest guys here, and we were right out of residencies / fellowship, and we just wanted to do everything we could get our hands on, and we didn't focus in those early days, and it took us a while to become mature to realize focusing was really the key. Focusing would be the best thing for you, for your career. It'll be best for your department, and it'll be best for your institution. So we got the message finally, a little bit late because we had no mentorship. But then once we started to focus and we started to specialize, then our careers really took off in a vertical fashion. So again, you've got to have a coach. I don't care how old you are. That's the only way. Take lessons, take as many lessons as you can, and that'll hold you in great stead as you go forward. So my mistake was not really having a mentor early on, or not really having the opportunity to have one to help me. So I learned a little bit by trial and error. Some of the decisions I made were bad, and some of the decisions I made were good. And then, from there, I don't know if you want me to go further into my stay here, but in any case, that's how we got it started. We got it started really, I think, perhaps not on the best foot because of unique circumstances in recruitment and in personalities. You have to realize you cannot control all the personalities around you. And occasionally, this will be problematic. You'll run into somebody who just for some reason doesn't like you. And that can really have a very significant effect on your career. And that's something you've got to be able to figure a way around, because there are going to be bumps in the road. Clearly, if everything you do is successful, you're not pushing hard enough. You're not being innovative enough. You're not thinking outside the box. You can't be successful in every single thing that you do, or else, you're not pushing hard enough.
Now, as you climbed the ranks to being the chair of the program, what would you say were some of the keys to your success that shaped your early career?
Well, some of it was luck and some of it was hard work. Early on, I actually, you asked me what were my goals early on, even in residency, and my goal I think even as a senior resident, I wanted to become a chief of plastic surgery by the time I was 40 years old. A little vignette, I was an intern at the University of Pennsylvania, and I rotated on the urology service. And I looked at the urology service in those days, and I looked who was there, and I said, my God, I could be chairman of this department, before I'm 40 years old. And they offered me a position. I told them I was interested, and they offered me a position in urology to become a urology resident. And I looked, and I considered it very seriously for that very reason. And then, as luck may have it, I thought about it. I said, listen, I'm going to stick with my original plan, and that is to become a plastic surgeon. So Again, my goal was really to become, my long-term goal was to become chairman of plastic surgery, and I wanted to do it before I was 40 years old. So I came to the clinic and I started working, and as luck may have it, the chairman at the time was not very effective, and he ultimately was asked to step down, and they needed an acting chairman, and I became the acting chairman. And the day that I became the acting chairman, I started working on, becoming the permanent chairman. We were on probation. The residency was on probation. We immediately got to work, got ourselves off probation, and started hiring plastic surgeons in the area of resident deficiency. And as we went through, as we hired our staff, we first hired a pediatric craniofacial surgeon to replace me so I could focus on cosmetic and becoming the department chairman. The next was a researcher, a full-time researcher that held us in great stead. That led us to doing the first full, almost a total face transplant in the United States because of that hire. And then we went on to hire a hand surgeon, and we built the department in the areas of residence deficiency. When I started, we were 5 plastic surgery staff, and we were 4 residents. By the time we go fast forward to 2020, we're 20 staff, and we will be 24 residents, and we will be 6 post-resident fellows. So the department's grown dramatically in this period of time.
That's an amazing accomplishment. And now thinking back to when you were going through all this trial and error run, with what you know now as a leader of the program, what advice would you have given your younger self going through those situations?
Well, again, I think I've touched a little bit on that, and that is, think strategically. Doing that every last case is not really the key to long-term success. The key to long-term success is to have a strategic short-term, intermediate-term, and long-term plan. And I'm a big note taker, and I like to, check things off my list. I make a lot of lists, and it gives me a great sense of relief when I can check these things off the list. So I've got the list made, and that list is a list of short-term, intermediate, and long-term goals. And you're going to make some of them, and you're going to miss others. But that's the way I think to progress, is really to have a plan and to stick to that plan. Some of the steps in that plan aren't going to work, but most of them will if you have the passion and the energy to put forward. So I think the keys to success are being a people person, 1, 2, have a passion for what you do, and 3, to let no rock unturned as you head towards your long-term goals.
Very well said on that. Couldn't agree with you more. Now, as a leader, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
I think the most important thing is to have something that's very special. I wouldn't come out as a jack of all trades. I think, and that specifically means a fellowship, a post-residency fellowship, I think is absolutely critical to long-term success in this day and age. Now, what that fellowship is, we go through trends on which fellowships are most popular. But I would say you should obviously do the fellowship that you are in the area, so especially that you're most interested in. That will give you a special degree of expertise, 1, and make you more marketable in the marketplace. That's number 1. But 2, what it will do in your early years, when I would go in to do a craniofacial case, just having come out of fellowship and started my staff position, you're always a little bit nervous about those first cases. But when I did a craniofacial case, because my background was strong, I could feel my pulse go down, my blood pressure go down, and I felt very, very comfortable. So it's going to take some time to build up comfort with a wide variety of the plastic surgery procedures that you do. The area of your special expertise, your fellowship, you're going to feel extremely comfortable in that area, and that's going to give you, I think, a good sense of belonging. And I think that's extremely important as well. So I think 1 is have something that's special that makes you unique in the marketplace. That's the first thing. Two is work on your people skills and make sure that you develop your people skills to the best of your ability. Take the best qualities of all your mentors, all the people that you come into contact with during your residency and fellowship. Take the best qualities from each one of those and try to incorporate that into yourself. Don't just mimic your mentor, because your mentor's got good qualities, but he or she may also have qualities that are not so good. So take that and just take the good qualities from that person and the better qualities from others and try to incorporate that into your own self-image. And remember, don't get a big head. There's always somebody out there who's just as good or better than you are. So don't get a big head and think that you are the be all and end all of plastic surgery or anything else. Be humble, be respectful, and realize that this country, there's some wonderful things about this country, but one of the bad things about this country is there's so many good people that we're all replaceable. And never forget that. We're all replaceable. So, give it your all, give it 150%. The only times that I think that I have been unsuccessful is when I have not given it my all. And there's a very interesting vignette by one of the famous football coaches of all time, and he had taken a job as a coach of the New York Jets, head coach of the New York Jets. He came from Notre Dame, and he never really wanted the job in New York. And every time something went wrong in New York, he said, this wasn't the right job for me. I never should have taken it. It wasn't the job, it was the person. And so again, I think it's extremely important to take those good qualities and incorporate those into yourself. And I think that will make you eminently successful.
Now, as you know, I speak to a lot of residency programs all across the country. And one thing that pops up a lot is, what does someone like yourself, the leader of a program, look for when you're interviewing for fellowship spots?
I think that there's some extremely important things when you're trying to build a team. You want team players. Type A's can advance the specialty, but they also can often be somewhat difficult to deal with. They can be egocentric, they can be narcissistic, and they cannot necessarily be the best person to build a team around. So I think if I'm looking for young staff, I want to make sure that they are team players. And as you go through and as you check references, if there's one red flag, just one little red flag that goes up when you research these people, stay away. Because usually that's a sign that there's difficulty, that this is a difficult personality. Also very interesting, there's some good data to show that the interview is really not very helpful at all, because you can get fooled very, very easily during a 15-minute interview. So I would tell you, do not count tremendously on the personal interview as a means of selecting an individual. I think it's much more important to go on their background, their references, rather than the interview process specifically.
Now, doing this year with the pandemic, and if there are no annual conferences, everything's being done virtually right now. What advice do you have for the graduating class regarding their networking and outreaching process when they can't meet folks like yourself at conferences?
Yeah, that's definitely, I think what you have to do, again, when you look at jobs, networking is extremely important. And usually the best choices that we make are those choices because people have been referred by friends, by colleagues that you respect and that you know intimately, that you know very, very well. Those are really tend to be the best recruits. So I think you have to fall back to your mentors and to bug them to help you identify potential job opportunities. So I think it's going to be networking with your friends, with your colleagues, and with your mentors and your teachers on, where are the opportunities? Is there anything you can do to help me? Here's what I'm interested in. Could you help me? And really not be afraid to bug people and make a first, second, and third phone call, because it is more difficult. But it's also been shown that these advertisements, by and large, these global advertisements are usually not very fruitful, because we fall back on really the people that we know and the references from people that we know. So I think that that's extremely important. I think there are a couple things. What do you do? Should you go into private practice, or should you go into an academic career? When I looked at this, it's very interesting. Why did I like general surgery so much? I love general surgery. I love being a general surgery resident. Matter of fact, I went out on a date. I was dating a woman at the time, and we went out to brunch with her sister. And I think I was a senior resident in general surgery, and I was telling her how much I enjoyed being the resident. Well, after the brunch, the woman I was going out with, she said, my sister told me, I got to get rid of you. She said, you're crazy. So be careful what you say. But I think that the first thing is you have a talk with yourself. Should I go into academics, or should I go into private practice? Make that list. All right, here are the pros of private practice. Here are the pros of academics. So why did I like general surgery? I like general surgery not so much because I liked the procedure. When I really sat down and had a talk with myself, I liked it because there was so much activity around. There was so much drama around. There were so many people around. It was like being on the baseball team again. And I'm not a loner. So I think that I don't think I would have been very happy in private practice, in an office. Plastic surgery so much now is, you're in your own ambulatory surgery center. You don't really interact with your other colleagues. And I think it would have been very lonely for me. In plastic surgery, same thing. I went into plastic surgery in the first couple of rotations that I was on as a first-year resident in plastic surgery. Where at the community hospitals, there were no other residents around, and I was miserable. I thought, gee, I think I probably made the wrong choice. But then I went back to the university hospital after 6 months, and it was, back with, a lot of commotion, a lot of people around, a lot of residents around, and things got a lot better. So I don't think I would have been very happy in private practice, just knowing my own personality. So that's why I chose it. You got to say, well, you're not going to make quite as much money in an academic position, but you're going to have the support of residents and fellows, and it's going to make your life on nights and weekends a lot better. So you got to look at those pros and cons, make the list, look at the list of the pros, look at the list of cons, talk to yourself, and talk to your significant other, and say, what do I really want out of life? What's going to make me happy? Not what's going to make her happy, or what's going to make your father happy, or to make your mother happy, but really what's going to make you happy. Because, realize, your career, my career has now been, it's been a 30-year career in plastic surgery. The other interesting thing is you look at the number of years we spend training and the number of years we practice. It's almost like a professional athlete, isn't it? Because I trained for 9 years, and my career is 30 years. So about a third of the time I've spent training, and only 2/3 of the time that I really practice my specialty as an attending surgeon. So it's sort of interesting way to look at it that way too. But I think you have to have a talk with yourself, and be kind and be truthful to yourself, and do what's going to make you happy, because the lifestyle is going to come, the money's going to come. I don't know any plastic surgeons who are starving out there, but I do know plastic surgeons who may be less than ideally happy with their position in life and their professional career.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.